Hello and welcome to Exercise Physiology Redux from the Institute of Clinical Excellence. I'll be your guide throughout the next couple of hours. My name is Alan Frendall. I'm a physical therapist from Michigan. I'm a CrossFit Level 2 coach, owner of my own private practice. I also serve as the Chief Operating Officer at ICE and teach in our fitness athlete and modern management of the older adult divisions. So why this course? This course is a revisiting of some basic principles of exercise physiology and nutrition that maybe we never really understood from high school and undergrad. Maybe we never learned. Maybe our major was different and we just went through the prereqs to get into PT school. Or maybe we went through a program that was a little bit out of date as far as exercise physiology and nutrition and how it relates to load and all things related to getting people moving and keeping people moving. So a revisiting of all the basic concepts. If you've stumbled upon this and you have never taken an Institute of Clinical Excellence course before, I just want to take a few minutes and talk about what is the Institute of Clinical Excellence. So ICE would consider itself to have three main pillars when we talk about what do we teach, what are we passionate about, where do we think the research is at in helping patients get better and stay better. We have a fitness forward mindset first and foremost, that we're advocating for loading early, loading often, early mobilization as much as possible with patients of all populations, that load applies to kids and pediatrics and young adults and teenagers. It certainly applies to the average middle-aged adult between age 20 and 55. It certainly applies to loading older adults. It applies to understanding how to load pregnant and postpartum moms, and as well as all those patients that may come in with no symptoms, just looking to improve their performance or get in shape, as well as those folks coming to us on the physical therapy side of things who are having acute pain, subacute pain, or even those folks who are dealing with persistent pain. And the incorporation alongside a higher dosing of load is incorporating high-intensity movement into your plan of care. Dosing your therapeutic exercise in a way that ramps up intensity, helps people get healthier, stay healthier, and overall live a higher quality of life. As our CEO, Jeff Moore, would say, how fit will you let us get you? So don't treat physical therapy as just a modality to reduce pain and improve range of motion and kick people out the door, but spend some time, use their visits wisely to really overall improve their health as a whole human being. Second, we're manual therapy skilled. We recognize that hands-on manual therapy is useful to reduce within-session pain and symptoms that lets us get back to that first point, which is loading early, loading often, and incorporating higher intensity exercise into our therapeutic exercise plan of care. This will let us better able to tolerate load. So being skilled with spinal manipulation, being skilled with things like dry needling, being able to recognize who's appropriate for manual therapy, deliver it, and get people back to that first point of being fitness forward, loading, and moving at high intensity. And finally, we are psychologically informed. We understand that a patient's expectations and beliefs impact outcomes, sometimes more importantly than anything else we do in the clinic, and that we really need to master the evaluation and treatment of patients with persistent pain and understand that it's not mechanical and it won't respond to traditional mechanical interventions that we're used to doing. From a organizational standpoint, we have courses all over the United States and Canada, live courses as well as online courses. This is our geomap from our live course portion of our website. You can find out where we're coming. We're probably coming near you with a course soon if we haven't already been in your area. So people always ask us, when are you coming to see me? Here it is. Here's what we have on our website for live courses. Our live course model, we go where people host us. We make it very lucrative for folks to host us. Often the host makes money, gets free seats, that sort of thing. So if you think your clinic is interested in hosting, please reach out to us. When we talk about what are our live courses, these are our live courses. As we talked about, fitness forward, manual therapy skilled, psychologically informed, cervical spine, manual therapy management, lumbar spine, manual therapy management, learn how to evaluate and treat the low back and neck, clinical management of fitness athlete live seminar, learn how to perform the major foundational barbell lifts, learn how to coach cue and correct them, corrective exercises to make sure folks are doing them mechanically sound, extremity management, manage the shoulder, the elbow, the hand, the hip, the knee, the ankle. ICE Sampler is our annual gathering. Gather once a year, all the faculty come, teach a little bit from each of their courses, give you a full smorgasbord of everything ICE, in addition to getting really plugged into the community and meeting all the faculty at the same time. Performing Artist Comprehensive Management, learn how to evaluate and treat the dancer, the performing artist in specific. Professional Bike Fit and Rehabilitation of an Injured Runner, learn how to work with the endurance athlete, that runner, that cyclist, that triathlete, that marathon, that Ironman, that ultra runner individual. Learn how to do video gait analysis on a treadmill, learn how to fit the bike for the cyclist and triathlete, and treat cycling-related injuries. And then finally, Total Spine Thrust Manipulation and Spinal Manipulation Symposium, all things related to spinal manipulation and incorporating that into your practice. Cervical spine and lumbar spine incorporate that as well, but they go a lot more into the exercise aspect of those conditions. There is some time spent on thrust manipulation and talking about the research behind thrust manipulation, but if you were just looking to really spend a couple days dialing in your spinal manipulation, Total Spine Thrust Manipulation is for you. Online, a whole spread of courses: Clinical Management with Fitness Athlete, Essential Foundations, and Advanced Concepts. In Essential Foundations, we have folks perform the same lifts we do in Clinical Management Fitness Athlete Live. We don't spend as much time on the coaching. We spend a lot more time talking about the research supporting the use of those movements in the clinic. We talk about things like acute to chronic workload ratio, heart rate variability, the evidence for loading all different populations. When you go into Advanced Concepts, you hit the ground running with all of the knowledge from the Essential Foundations course. You start off by really learning how to programming an entire week of strength training for an individual, programming an entire week of conditioning for an individual, an entire month of conditioning for a group fitness class, programming for the injured athlete, for mobility, for special populations athletes like pregnant and postpartum athletes, and really dial in your business plan to become the provider of choice with active individuals in your community, to set up yourself to work with the CrossFit box, to set up with a local high school sports team, that sort of thing. Advanced Concepts, it finishes you off and gets you started to go and become the provider of choice in your community for those active individuals, your powerlifters, your CrossFitters, your Olympic weightlifters, your endurance athletes. Clinical Management of the Fitness Athlete, Pregnancy and Postpartum really dials in on that special population of the pregnant and postpartum mom, how to modify exercises for the pregnant mom, when to progress back to activity, and how to do it for postpartum moms, and all the literature supporting that. Modern Management of the Older Adult, Essential Foundations and Advanced Concepts. Essential Foundations takes you through the literature supporting using heavy load and higher intensity for the older adult. It also gets you set up for Advanced Concepts, where you'll dive deep into a couple of special populations, working with patients with neurological conditions, cardiopulmonary conditions, and then setting yourself up to work with the master's athlete in your community, how to set up your own group fitness class for the older adult, how to add an additional revenue stream to your clinic, or maybe, as some folks have done, transition out of traditional patient care and just work with group fitness with older adults. Out-of-network step-by-step with Sarah and Kate takes you through all the steps you'll need from not starting anything to being ready to open your doors to open your own cash-based out-of-network clinic. All the administrative, all the legal things you need to do to transition from being in network currently as a provider, or maybe an entire business owner, or those of you who are already kind of doing a side hustle, how to level that up and open your own practice. Persistent Pain Comprehensive Management with Justin Dunaway really dials in 8 weeks, all things dealing with the patient with persistent pain, what is going on with these patients from a physiological basis, and then tons of ways to refine your evaluation and treatment for that population. Primary Care Physical Therapy with Eric Chaconas and Morgan Denny really dials you in on being the primary care provider in your community. So not just being the direct access physical therapist, but how to, especially those of you in rural areas, really step up your game with being a primary care provider, how to dial in things like blood pressure, how to dial in things like listening to heart sounds and lung sounds, how to evaluate if somebody has maybe a fracture going on, how to read imagery, look through common medications and interactions, and really focus on becoming a primary care provider as more and more of us are direct access providers in our community, with folks skipping the physician on their way to see us. Spinal manipulation digital coaching. If you want to get into motion analysis of your spinal manipulation with Justin Dunaway, he loves that stuff. He loves to nerd out on that stuff. He is happy to give you a package of motion analysis where you'll submit videos of spinal manipulation, and he will tell you what you're doing wrong, how to refine your technique to be more effective with your spinal manipulation. Telehealth with Rob Vining. We know big surgence of telehealth during the COVID-19 pandemic, where pretty much no PT was doing telehealth. Some PTs weren't allowed to by State Practice Act. A lot of emergency orders, a lot of changes to State Practice Acts, with a lot of PTs being able to conduct telehealth within a matter of a few weeks during the COVID-19 pandemic. So we have that course of how to maybe transition your entire practice model to telehealth, or certainly add it as a significant part of your practice. He takes you through all the steps you need to do to set yourself up from a technological standpoint, from a legal standpoint, from an administrative and billing standpoint. Rob does a great job of that within 8 weeks to add that arm to your practice or help you switch your entire practice to telehealth. And finally, we have Virtual ICE, our online mentoring. We meet once a week. We have about an hour of lecture and discussion on a different topic. All the ICE faculty participate, so you get a wide spectrum of topics. Some niche topics that really don't make sense to have a whole course on are found in Virtual ICE. That is $29 a month. You can cancel at any time. If you stick around for a year, you get 24 CEUs. So it's a great way to get some cheap, high-quality CEUs from home and get exposed to newer research, emerging areas of practice that maybe don't make sense yet to be incorporated into a full course, and kind of get ahead of the curve and stay ahead of the curve within Virtual ICE. But we're not just about selling you stuff. We also really believe in giving back to the PT community as much as possible, not just for awareness, but really talking about emerging things sometimes the day after a piece of research comes out or a new idea or a new concept. We have PT on Ice Daily Show. If you aren't subscribed yet, please consider subscribing to the podcast. Follow us on Facebook and Instagram. We go live every single weekday morning. We've done that for the past couple years. Live at 8:30 a.m. Eastern on Facebook and Instagram. You can watch us live. After the live podcast is over, we put it on podcast format, so wherever you get your podcasts, Spotify, iTunes, whatever podcast app you use, search for PT on Ice Daily Show, you'll find us. We put all of our old episodes on YouTube, so if you want to binge on past episodes and get caught up, you can find those on YouTube as well. Every single weekday, Monday through Friday. Every day is a different topic. So Mondays is Q&A. We answer your questions. If you have a question for one of the ICE faculty, we'll answer that live on Mondays. Tuesdays are Clinical Tuesdays. We talk about manual therapy techniques. We talk about exercise progressions. We show you those hands-on techniques on video. Wednesdays are Jerry on Ice, so Dustin and Christina talk about all things older adult. Thursdays are Leadership Thursdays, so Jeff, myself, a couple of other ICE faculty jump on Thursdays and talk about leadership, business management, business practice, tools and strategies to help you either develop yourself as an individual leader, as a business leader, or develop your PT practice if you happen to be a PT manager or PT owner. And then on Fridays, we have Fitness Athlete Fridays. We talk about all things fitness athlete, the powerlifter, bodybuilder, Olympic weightlifter, CrossFitter, the pregnant and postpartum athlete as well, with Christina jumping on there. So myself, Zach, Mitch, Christina, Kelsey, Valentine all take turns on Fitness Athlete Friday. Jason London jumps on as well and gives his perspective on the endurance athlete in addition. So check out Fitness Athlete Friday. I would argue that's the best day of the week, but I am biased to teaching in the fitness athlete division. We also have the Great Resources tab on our website at ptonice.com. Tons of free stuff, high quality stuff too. We're always adding new things here. We have ebooks. We have Run Your Own Insert Here workshop, What are those? You sign up, you get the slides, you get the video of the faculty member giving that workshop out in the community, and it's kind of step by step how you can set yourself up to give that workshop in your community, a way to increase outreach of your clinic, a way to get people to your clinic, a way to create new programs within your community. We have those create your own workshop resources on the resources tab. We have ebooks on cervical spine manipulation safety, on strength and conditioning equipment we think is essential for the clinic, on incorporating REMOMs, rehabilitation every minute on the minute, to increase the intensity of your therapeutic exercise. And then we also have some free continuing education that's posted on the resources tab as well. We have Hump Day Hustling. You can sign up for Hump Day Hustling on the bottom of every single page on our website. Put in your first name, put in your email address, and get signed up. We never spam with Hump Day Hustling. What is it? It's 5 to 6 pieces of the newest research or content we think you should see from the past week. It comes to your inbox every Wednesday morning at 8:30. We swear we never spam, but I want to show you what it actually looks like so you can see what it looks like and not just take my word for it, that it's not just full of spam. So this is what a typical Hump Day Hustling email looks like. It's going to have a little introduction. It's going to have a summary with a link to a couple of articles or high-quality social media pieces like this. So this one has 5 articles, and then that's it. A little outro usually has, if we've released a new piece of free content, if we've released something new on the resources tab, a little announcement at the bottom. Very brief, what courses are coming up within the next couple weeks, and then that's it. That's all that comes to your inbox. That's all we ever do with it. We never use this to email you about courses. We never use this to try and sell you stuff. This is all we use that email list for. We're very, very, very aware that folks are getting bombarded with spam email all the time, and we don't want to contribute that at all. We want to make sure you get a little blip of some research that might be relevant to you, some content that might be relevant to you and your patient population. Get in, get out. So that's Hump Day Hustling. Sign up for that if you're not signed up already. We often get this question. I spend some portion of my day every day answering this question about things related to CEUs. First things first, it depends on your state. Like everything in PT, it depends on your state. We are approved in Michigan. We spend a lot of money to be approved through Michigan, being based in Michigan. Through that, some states have what's called reciprocity. If you are approved with a state that they recognize reciprocity through the Practice Act, you get approved in those other states. Some states don't require Con Ed still. Some states don't approve Con Ed. Everything is approved. So the list of states that our courses will count for is on the website. Just because we're not approved in your state on this list does not mean you cannot get credit for our courses. What you'll usually have to do is find the section on your website, your state association website, your state board website that deals with continuing education. There's usually something called individual approval. That usually involves filling out a form. Sometimes there's a small fee, sometimes not. You fill out that form, you pay the money or not. If it's free, you submit some stuff, the outline, maybe the slides of a course, whatever they ask for, and they will give you CEU credit for the course, live or online. So just because your state isn't on this list doesn't mean you can't get credit for our courses. So, all that being said, why this course? Why this mini course? This is the first mini course ICE has done. Traditionally, our online courses are very, very engaging. They're 8 weeks with a live meeting every single week with homework and exams and a lot of discussion. Very, very engaged. Not read for credit by any sort of stretch of the imagination. So this is our first mini course, and why are we doing it? We think this is really important stuff. This is stuff that is the basis for our profession that PTs are a little bit weak at, maybe a lot of bit weak at. For whatever reason, you never had this coursework in undergrad. Maybe you were a piano major and you never went through an exercise physiology course. You just took the prereqs, chemistry, biology, anatomy, and physiology to check those requirements off to apply to PT school. So we have an overall lack of basic exercise physiology knowledge, especially how to apply it, how to test somebody from an exercise physiology standpoint, how to test their strength, how to test their conditioning, and use that in your plan of care to help them get better, to improve at those weak areas. That applies to the clinic, but it also applies, we need to think about being outside of the clinic. Seeing patients that come in the door that are sick and hurt is a really reactive style of medicine. We want to be proactive. We want to get out there. We want to work with the high school sports teams. We want to work with active individuals and keep them moving. Not only does that apply a separate revenue stream to our clinic that might be cash-based, that's going to let us not be so heavily reliant on insurance, but it's going to help people get healthier and keep them healthy, which is how we change the health landscape of our country. So because there's that lack of basic knowledge or maybe a misunderstanding, we know and we see that a lot of PTs have difficulties applying advanced exercise and load prescription in the clinic. Patients are underdosed. They're often working at low intensity. We know that's a combination that doesn't really improve symptoms for those folks on the PT side of things, but overall does not lead to an improvement in strength, in tendon strength, in cardiovascular change when we have a combination of low load, low intensity. We know that PTs lack a basic understanding of nutrition. Nutrition is arguably the most important aspect of a human being's life. Patients come to see us maybe 2 or 3 times a week for an hour in a traditional clinic setting. Maybe those of us in an out-of-network practice, we're seeing somebody every 1 to 2 weeks, one time. So nutrition is the other 23 hours in someone's day. You'll never make profound change in a patient's life, in their plan of care, if they're eating McDonald's 3 times a day and coming to PT twice a week for an hour. All that other time spent mismanaging their nutrition is going to negatively impact their long-term outcomes as well as their short-term outcomes in the clinic with you. And finally, again, just an overall underdosage of load and lack of incorporation of heavy load. And their heavy load doesn't mean max out your lifting when you come into the PT clinic. It means we need to load you at a significant amount relative to what you can lift in order to create actual change in your tissue, in your tendons, in your muscles, in your neuromuscular system. Not doing that significantly stretches out a plan of care. It involves somebody being in pain longer. And overall, underdosing somebody is why no-show cancellation rates are so high. People are not seeing change. They don't see the benefit of physical therapy, and so they stop coming. And so once you really start to dial in your exercise prescription, your load, the increasing of intensity of your therapeutic exercise, and talking about nutrition, helping patients dial in their nutrition, you find their plan of cares are shorter, people get better faster, the retention is there from a no-show cancellation standpoint, and people really start singing your praises, and you don't have trouble keeping your schedule full of active, engaged patients who don't cancel or no-show their appointment. So that's why we've developed this coursework. So what's on deck? What's coming at you? The first thing coming at you is that nutrition lecture. This will be free for the entire PT community forever. We really believe that every PT should know this. Again, it's the other 23 hours in a day. So Nutrition Simplified is going to take you through the basics of nutrition. What is a carb? What is fat? What is protein? Why does that matter? How can we dial in a patient's nutrition? What does the research say to help facilitate that exercise response? The second lecture, Exercise Physiology 101. What's actually happening during exercise? How do we apply progressive overload? What does testing a max in the clinic look like? It's probably never going to look like testing a 1-rep max, but how can we be certain we are loading somebody appropriately, and how can we apply that exercise prescription to optimize outcomes? I would argue that's equally as important as nutrition, but we think that nutrition lecture needs to get out to everybody out there. The third lecture will dive deep into general physical preparedness, or what's called GPP, versus specialization. Which one is right for your patient and why? Should we just be kind of doing general exercise for our patients, or should we be specializing? And who gets what and why? The fourth lecture is just going to be case examples of applying nutrition, examples of applying load, examples of which patients do good with GPP, which patients need specialization, and why. And then finally, there's a quiz. The quiz is not mandatory, but if you need or want CEU credit, you do need to take the quiz. We just need to check that you've actually learned something. The quiz, don't sweat it. People always see quiz, people see skills check, they start to sweat, they think back to PT school when they failed a practical exam because they misread the blood pressure cuff by 2 millimeters of mercury or something like that. Don't sweat it. It's straightforward. The questions are going to be from the lectures. No trick questions, none of that NPTE stuff where all the answers are right, but one answer is the most right. None of that stuff. If you paid attention, if you stayed awake, if you looked through the slides and you paid attention to the video lectures, you'll do just fine. So that's what's coming at you. We're happy to have you. We're glad you can be here. We're excited to get started with you in the nutrition lecture.